Hello, my name is Michelle Nguyen, and today I'm going to be doing my medication administration video today. Okay, so the first thing I am going to be doing is I'm going to plan my medication administration. I'm going to avoid any interruptions. So I'm going to limit conversation with colleagues and not take any phone calls, and I'm going to follow my no interruption zone policy. Next, I'm going to compare my patient care order form with my MAR. So the first thing I am checking for is right patient. Jaguar J. Jones. Date of birth 8/25/1963. Date of birth 8/25/1963. Right medication. Novolin R, regular insulin. Novolin R, regular insulin. Right dose 10 units. Right route subcutaneously. Right time 30 minutes before meals. Right indication, I would making sure that his blood sugar levels is regulated. Now for my patient allergies. Allergies penicillin. Now I'm going to put my patient care order form to the side. Now I'm going to perform hand hygiene. Now I am going to be performing my first check of my medication administration. So first, right patient. Jaguar J. Jones, date of birth 8/25/1963. Right medication. Novolin R, regular insulin. Novolin R, regular insulin. I want to also make sure that my medication has not expired yet. Next is right route. I'm beginning it subcutaneously, and I'm going to be choosing the 29 insulin syringe. Right dose 10 units. And I'm going to be getting 10 units. I'm going to wipe my bottle. Since we need 10 units, I'm going to be injecting 10 units of air. Now I'm going to make sure that there are no air bubbles. So now I have 10 units for my patient. Now I'm going to recap my needle using the scoop method. So now I would also ask another nurse to verify my medication if necessary. So for right time, 30 minutes before meals. Right indication, make sure that the blood sugar levels are regulated, and then my right documentation, all legal prescriptions are included. Now I am going to do my second check of my medication administration right. So Jaguar J. Jones, date of birth 8/25/1963. Right medication. Novolin R, regular insulin. Novolin R, regular insulin. Right dose 10 units. Right route subcutaneously using a 29G insulin. Right time 30 minutes before meals. Right indication, his blood sugar levels are regulated, and right documentation that all legal prescriptions are included. Now I'm going to be writing the drug name, dosage, and my patient's name. So Novolin or insulin, 10 units. Jaguar J. Jones. So now I'm going to take my medication, my vial, and my MAR, and I'm now going to head into my patient's room. So now I am going to be doing my third check of my medication administration, right? So first I would perform hand hygiene before coming in, and then I'm gonna go to my patient and I'm going to lower the side rails, raise the bed to a working height, making sure that my patient is comfortable. So now I'm gonna do my first check. So right patient. Right patient, Jaguar J. Jones. Jaguar J. Jones, date of birth 8/25/1963, date of birth 8/25/1963. I'm going to check to see if my patient has any allergies. So allergies, penicillin. Then I would ask my patient if they have any other allergies that I should be aware of. And then I will perform any necessary assessment, such as like blood rate, pain levels, and stuff like that. Now I'm going to do my right medication. Novolin R, regular insulin, Novolin R, regular insulin, Novolin R, insulin. Right dose, 10 units. Right route, subcutaneously. Right time, 30 minutes before his meals. Right indication, blood sugar, making sure the blood sugars are regulated. And right documentation, all legal prescriptions are included. So now I'm going to tell my patient that I am going to be giving them an insulin injection, which is, since it's subcutaneous, it is in the abdomen. So if we go 2 inches around, we can't go past the costal margin, not below the pubic area, and not past the anterior superior iliac spine. And I can go at a 45 or 90 degree angle. So I'm going to clean. I'm going to use this to point my injection site. Going to pinch the skin, and either I can go at a 45 or 90 degree angle, but I'm going to go at a 90 degree angle. Okay, so I'm going to apply pressure and not massaging the site. So after this, I would clean up all my area. Dispose of my gloves, and then I would position my patient in a comfortable height, and I will assess for any allergic reaction to the medication. I will come back and give it a few minutes, and then come back and check on my patient. I will raise the side rails, lower the bed, making sure that my patient is comfortable. And then for documentation, I will document making sure that my patient didn't have a reaction to it, the pain level, and I would be documenting that on the MAR, making sure that my patient I would just document everything on my MAR about how my patient tolerated the procedure and if they had an allergic reaction. And I will come back and assess the area.